Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
Yes. So generally, patient presenting with cataract, they come with vision problems. So we need to do a detailed eye examination. So people say that it might be because of glasses, unaware of that they are having cataract. So we need to have a detailed eye examination and also do certain assessment. We call it as cataract assessment or cataract surgery assessment. This is basically a review of patient conditions. Most of the elderly patients will have diabetes, hypertension, cardiac disease. They might be on so many other medications. And we also want to know whether the cataract is primarily because of the age-related issues or due to few other comorbid or additional conditions they might have. Like diabetes can lead to a cataract called as diabetic cataract. All right. So we have to do a detailed eye examination, and history has to be taken to know about the patient first thing. The second part is the ophthalmic eye assessment. So we measure the power, we measure the corneal curvature and also the length of the eye to ensure that we put the optimal intraocular lens. Cataract surgery is nothing but we are removing the damaged lens and inserting a new artificial lens. So this new artificial lens, we have to calculate the power properly so that patient can see without any visual aids or glasses. So this diligent assessment is important. And then we also discuss with the patient about the anesthesia options. So patient have to be comfortable, pain-free, and should not experience any discomfort during the surgery. So we also need to discuss the anesthesia options. So nowadays, cataract surgery is done under topical anesthesia. So this only eye drops is applied. For some patients, eye drops may not be essential. For those patients, we apply give an injection around the eye so that patient will not experience any eye pain or discomfort. So these are the common methodology before cataract surgery. And generally preparation in once the tests are done, we have to counsel the patient about the pre-operative procedures and before surgery, what all they have to do, what precautions they have to undertake, what medicines to continue, and some medicines have to be stopped before cataract surgery. So all this discussion will take place during the counseling session and the assessment with the eye doctor. And then we prescribe certain eye drops before surgery. This is to prevent any eye infections, clean the eyelids, as well as dilate the eye. So this is essential for a cataract surgery. So we also discuss with the patient, if the patient is a diabetic, whether it has to be take the regular medication. That's important. Patient who are other medications. So all this discussion takes place prior to the surgery. So in short, we call we have a short mnemonic for the patient to easily remember this. We call it as prior. So P for pre-operative test, R for regular medications reviewed, and I for instruction from the surgeon, and O is for organizing patient's health, support attender and anesthetist, and then R for food restrictions and review of all these problems. So patient will easily understand these are the things they have to follow before coming for surgery.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
Okay, so smooth recovery, basically the patient should not rub their eyes in the post-operative period. Some of us apply a shield to prevent patient from rubbing, or we also give a post-operative goggles. So it's a protective goggle so that patient doesn't rub the eyes or use any any other method to rub the eye. And second thing is you need to limit bending and lifting and movements in the first few hours. And eye drops have to be prescribed as advised. This is very, very important. And also have a very clean environment. That's important. Avoid eye rubbing and rest adequately. So very often we see patients going back to the work within few hours, or using mobiles or TV, mobile phone or TV in the post-operative phase. So this can be restricted, even though they may not cause much damage. To have good healthy recovery, all these are essential. So safe recovery is very important. So patient also have to follow the safe measures.
Agreed, doctor, what you said. Are there any common complications after cataract surgery and how they can be managed or prevented?
Right. So generally, for cataract surgery, the complication rates have drastically come down with the advent of new technology and better understanding of the patients and the advanced technical procedures. So now there are very good phaco machines. In those days, when cataract surgery is done, we put a lot of sutures for the eye to. So the eye will take a lot of time to recover, as well as patient will have suture based irritation and inflammations. But of late, it's all sutureless surgery and very small minimal incisions or micro-invasive cataract surgeries. So these micro-invasive surgeries are post-operative. The complications days are negligible. And in fact, the cataract surgery is one of the commonest surgery being undertaken, and that too without any complications. But some patients might have problems because of the advanced nature of cataract or the comorbidities, what we call it as additional diseases the patient might have, like diabetes, hypertension, eye pressure or glaucoma, or retinal problems. So these diseases can lead to poor visual outcomes or delayed recovery. So these diseases have to be taken care of well during the post-operative phase. So generally, the common post-operative problems are related to maybe bleeding from the eye. So that can be easily taken care of. Eye pressure raise, it will be a temporary phenomena. And then allergy or what we call it as inflammation of the eye. So this will be in the early phase. So we give certain medications to control that. And also to prevent infection, we give antibiotics and few medications to reduce the infection as well as inflammation. So if the patient takes care of the post-operative part very well with the help of the attenders or nurses, definitely the complications are very, very minimal. So modern day cataract surgery is a very safe procedure. So patient can undergo the procedure as a daycare procedure. They need not even stay in the hospital. It's a few hours procedure in the hospital. They can go back to the homes within few hours.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.